Good morning, beautiful people. We're going to talk about choice, and we're going to talk about, we've been talking about cravings all week long, and I really want to just talk a little bit about choice in relation to cravings and a couple of things that have come out with Dr. Greger's material about how to lower cholesterol. He came out with a really good ebook this week that I've been waiting for about how to lower your cholesterol using your diet. So we'll talk a little bit about that. I'm Dr. Natalie Gonzalez. I practice integrative and functional medicine. I'm a retired surgeon who went back to train in integrative medicine, which means I'm going to be using the best of both alternative and conventional medical means to optimize somebody's health. And functional means that I'm going to be looking for the root or underlying cause of a medical or health condition so that we're treating it at its source rather than putting a Band-Aid on. This morning, I want to talk a little bit about Dr. Greger's new book. This had to do with how to lower your LDL, which is the bad cholesterol, how to lower your LDL levels just with using food, supplements, any kind of natural means of doing that. And there are some really interesting things that came out of the book. The first one is that even if you used all of your dietary means of taking out all the saturated fat, animal fats, all of those saturated fats out of your diet, you will still, in many cases, many people genetically are still going to have a higher than normal or higher than optimal level of cholesterol. And I may be one of those because genetically in my family that may be true. But the other thing that's interesting is that we always knew that your body makes cholesterol all the time. So even if you don't take it in, you're still going to be making some. And that cholesterol is made by the liver and gets shunted into the intestine with the intention of it being shunted out when you have a bowel movement. And some people, especially people that are constipated or have very hard stool, they may retain that cholesterol. So the cholesterol goes from the liver where it's being made, it gets put into the intestine, and if it sits there long enough, your body reabsorbs it back into your bloodstream. And so to have something that the cholesterol attaches to and to be shunting that out of your body through the stool is the gist of what you're doing with your diet. One of the other things besides not taking in cholesterol. So in order to do that, he suggests that we have what he calls sticky fiber, fiber that you find in artichokes, okra, it might be barley. There are a number of sticky fibers that he suggests taking in so that the cholesterol gets attached to those fibers and gets shunted out of your system through the stool, through your bowels. So that was one way. And then there were numerous other ways. Flax was one of those sticky fibers also. Another way to lower the cholesterol were through certain spices like berberine, which you can get in barberry. And he mentions a number of spices in his book that will help you lower your cholesterol normally. He talks about, he had some very good information. Stanols and sterols are found in plant foods, and they are the things that help you lower the cholesterol naturally in your bloodstream. But if you are a constipated person, you're not going to get rid of that cholesterol through your bowel very well. You're going to be absorbing a lot of it back in. So you want to make sure you're somebody who's having regular stools and that those stools are taking the cholesterol, attaching it to the sticky fiber and taking it out of your system all of the time. Otherwise, you're going to end up with higher than normal cholesterols. He talked a little bit about the use of certain medications, and those would be the statins. And there will be some people that we cannot get their cholesterol down without those statins. The statins are a medication that it may actually work better than taking red yeast rice, which is also got a statin medication in it that is for lowering cholesterol. The problem with red yeast rice is that it contains a toxin normally. It's naturally containing this toxin that you really don't want to have in your system. And unless that's taken out in the supplement, and it's hard to guarantee that it's taken out in the supplement that you're taking of red yeast rice, you may be getting that toxin in your system. So red yeast rice, we know, has a statin just like our medication, but our medication is just a little bit better controlled than the supplement of red yeast rice that's out there. And that's why in some cases when we need to use a statin to get somebody's cholesterol down, we'll go ahead and use the medication because it may be a safer alternative. So that's the use. When I say I'm practicing integrative medicine, I'm practicing the best of both alternative medicine, which would be the red yeast rice, and conventional medicine, which would be the statin, to help lower somebody's cholesterol. And it's not everybody who's going to need that, but there's a certain percentage of the population that will. And so anyway, I've been struggling for the last few months with this idea of trying to practice in a compassionate way, to give people the tools that I think are going to be best for them, and then to be able to step back and let them choose out of those tools that I've uh, educated them with, what they're going to actually use or not. And that's a very difficult way to care about my patients and clients and family and friends enough to let them know what I think is best, and then to be able to step back and allow them the choice of what they actually want to do. And Dr. Greger, in this last book, I know he's been struggling with this also, the whole idea of being able to put all this information out for everybody and yet see it fall flat or not be used. It's been a very difficult struggle for him also. And he says in his book, I know this is a lot of work. I know it's very complicated in many ways. And he did try to simplify it as much on a day-to-day basis as possible in this book. But he did say, I wanted to lay out every evidence-based tool that I could find, so that he went through all the research to find the evidence for these tools to be able to use to lower your cholesterol levels. And he said, so that you could so that you could mix and match each of these things to give you as much control over your destiny as you choose. And so to be able to say, I want to give you the control that you're asking for, but I want to let you choose what you're going to do. And so again, he is trying to just step back and let people choose in a very compassionate way, to allow everybody to have that choice over what's going to go on in their health in their lifetime. We all realize that we're in these bodies for a temporary amount of time. We want to make we want to make the best of them, and at the same time, we want to be able to enjoy each of the moments that we have here. So I'm Dr. Natalie Gonzalez. This is these are live sessions that I'm doing every day at 11 o'clock as much as possible this month to get used to doing this. I'm hoping in the next week to be able to announce them ahead of time so YouTube knows who to present them to, and let them know that we're going to be doing these sessions. So I haven't mastered that part of being able to get the word out there ahead of time so that people can sign on and listen to this. But if this has been helpful to you, share it with a family or friend. If you don't know who to share it with, like it so that you too can share it with people similar to you. Like and subscribe if you haven't, and we'll see you in the next video. Okay, take care, lovely people, and we'll see you later.